Many times families come to us and they've done a lot of research on their own and have a quite good understanding of the different types of operations that are available to make a large tongue smaller. Perhaps the two most common operations that exist are either a keyhole approach or a W approach. There's many modifications of those two operations, but in the big picture, those are the primary ones. Either a keyhole approach, which works on the center of the tongue, or a W approach, which works more on the sides and the tip of the tongue. We prefer the W approach. I think that gives excellent results, both in terms of length and width of the tongue. I think it's a very safe operation, and I think it can be done very quickly and in a way that's highly effective. And so because of that, the operation that we do is the W technique. Let me take you through an operation so I can describe exactly how the operation is done and what families can expect afterwards. The operation takes about an hour to perform. It's done under general anesthesia, so the children are sleeping. Before going into the operating room, we give the children a very light sedative to drink. This way it takes away any anxiety that the child may have, and this is important particularly in the older children. Once the children go to sleep with the anesthesia, we then perform the operation. One of the questions that I often get asked is, how much do we take off of the tongue, or how do we know where to make the cuts? And I think that's a great question. And the answer is that we tailor it to fit the child's mouth. And we do this by feeling where the gum is, or feeling where the teeth are, and adjusting the pattern that we use to do the surgery, the W pattern, based on that position. So after the child is asleep, we then do the markings, we perform the operation, we close all the surgery with sutures, and then the operation comes to an end. One of the things that we do at our center is we always try to take the breathing tube out at the end of the operation. And I think this is really important. I think this speeds up recovery, I think it leads to less complications, and I think it leads to a quicker trip home for the child and the family. So at the end of the operation, we take out the breathing tube. The child goes to the ICU for typically one night, and then they're in the hospital for about 2 to 4 days more after. The variation in hospital stay really depends on one thing, and that's feeding. So as soon as the child is feeding well, and that basically means taking liquids and soft food, they get to go home. And that's the important thing. We try to get the kids home as soon as possible after the operation. The healing process, once the children go home, is quite straightforward. Usually it's about 3 to 4 weeks where the tongue is actively in the healing process. What I mean by that is the tongue is still swollen, it still has post-surgical changes, the stitches are still in place, there may still be some foul odor or some bad breath as the tongue is healing, but fairly quickly all of that improves, and it really takes about 3 to 4 weeks for that to happen. By about a month out, most of the stitches are gone, and the tongue is beginning to take this shape that we desire, to have a normal shaped tongue. What we know is the tongue will be stiff at that point. I tell families, think about if you were a runner and just had surgery on your knee. For a few weeks after surgery, your knee would be stiff, but in time, you regain its full mobility. And the tongue is no different. The tongue gets stiff after surgery. It may be hard for the children to lick their lips or lick an ice cream cone, but within the next few months, that all comes back. And we see the tongue start regaining its motion and regaining its ability to perform its normal functions that the tongue was designed for. So families often ask, if they don't do surgery, are there any other options that they can do to help their child? Unfortunately, there's no medicine that can be taken. There's no pill or injection that we can give to make the tongue smaller. So we can't correct the macroglossia without surgery. In children who have the sequela of macroglossia, or the results of macroglossia, and those results are mild, that can be corrected with orthodontics. In cases where the sequela of the macroglossia is severe, such as a large open bite or a large crossbite, only orthognathic surgery or jaw surgery can fix that later. Speech therapy can be helpful, not only in terms of articulation of speech and language, but also in terms of feeding. And we certainly recommend that a child with macroglossia has a speech evaluation with a speech therapist. That won't fix the macroglossia though. It may help improve some of the symptoms, but unfortunately it won't fix the issue at hand. Really the only way to do that is with surgery. Another question that we often get asked is about speech. How will tongue reduction surgery affect speech? Many children who have Beckwith-Wiedemann syndrome need speech therapy. And you can have speech issues because of the large tongue, or the speech may be normal. It's unpredictable. Every child is different. So we always recommend a speech and language evaluation beforehand. Of course, in the small babies where they don't have language skills yet, we can't get information about their speech, but it's still important to have that evaluation. The operation is designed, as I mentioned before, to fit the tongue inside the mouth. So tongue reduction surgery should not have any adverse consequence on speech. If a child was going to have speech issues before, likely they'll still have them after tongue reduction surgery, and vice versa. If the speech was to be normal, it should still be after tongue reduction surgery. And again, that's because we're shortening the tongue, but we're still leaving the tongue in the normal anatomic position. We're creating normal anatomy so that the tongue can function normally. Of all the operations that I do, doing surgery for macroglossia is probably the single most satisfying part of my career. Of course, we don't want to do operations on children. I wish we never had to operate on children. But when we do, and the child has a problem, that in a very finite period of time, 30 minutes to an hour, we can fix that problem forever. That's really a wonderful feeling, both as a surgeon and as a parent, to know that there's help for your child. The operation is not easy on the family. There's no question about it. I don't think there's a single family out there that will say it was an easy few days. But I tell the families each day, one day down, tomorrow will be easier. And I think the families know that. And each day, as we see the child make steps towards recovery, towards going home from the hospital, we all appreciate what a good operation surgery for macroglossia is and how much it helps the child. I don't think I've ever had a family say that they were sorry that they chose to have an operation for macroglossia. Of course, immediately after the surgery, it can be scary, there can be anxiety, the families are concerned as the child's healing. But once the tongue is healed, and once we see that open bite and that cross bite begin to reverse itself, and we see the child living a normal life with the tongue inside the mouth, without any eating issues, without any social stigmata, it's really, really a wonderful feeling.